Apo, is it okay there?
Sure.
Then where is the podium? Where is the PS?
Podium, daily podium.
Where is this? Where is Lindex?
Apo, is it okay there?
Sure.
Then where is the podium? Where is the PS?
Podium, daily podium.
Where is this? Where is Lindex?
So, Your Excellency, thank you. So, Your Excellency, thank you very much for having gathered us here today. And in the interest of time, I'll just spend 1 minute to introduce the team that is here. We have the AMREF group led by Dr. Aide. And basically what AMREF has done is to coordinate this whole exercise, Your Excellency, on behalf of the Ministry in the procurement and distribution of the oxygen cylinders to all the counties. We also have the funder, Mr. Morrison, from Global Fund, who has just arrived. Your Excellency, there was a small delay at the airport, but he has just arrived and is with us. He will speak to what he has been able to do, and he has already apologized. And also, Your Excellency, Ministry of Health officials are here, led by our capable Cabinet Secretary, and who will invite you to speak. But for now, let me just call Dr. Aide, the CEO AMREF, just to come and speak to the whole ecosystem of oxygen, so that you can invite Mr. Morrison also to give a brief.
Asante. Yeah, I think you're speaking to my future, Your Excellency. Yeah, thank you very much. Excellency, distinguished colleagues, it gives me great pleasure to be here today to talk on this issue that touches all universal coverage. And I'm really, really touched by how eloquently, Your Excellency, you discussed the issue of universal coverage and primary health care for this country, for now and the future. Let me just very quickly introduce AMREF Health Africa as a partner of the Global Fund. AMREF Health Africa, Your Excellency, is actually globally headquartered in Kenya and hosted by your government through a host country agreement. I myself am the first Kenyan to actually lead AMREF in 2015. So we are very proud that AMREF Health Africa, a global NGO headquartered in Kenya, is actually led and headquartered here. And we spend significantly across the areas of HIV, TB, malaria, primary health care, community health, promoters now, and community health workers. And we spend over 10 billion Kenya shillings in the health sector, including the AMREF University, the work we do in the programs, in the Kenya Country Program, and also AMREF Flying Doctors. We are partners of the Global Fund for HIV malaria time, and we work very closely, not only in Kenya, but in Tanzania, and also in other countries. So as an organization internationally hosted in Kenya by your government, you are then by nature our patron. So we are here on your behalf. Thank you very much. We wish to thank the Ministry of Health at the national government. We also wish to thank the county governments for a very harmonious working relationship with this organization since 1957. This is more than 65 years of AMREF working in this country. And today, with the multilateral support of the Global Fund, and I'm glad my friend and brother, Lyndon Morrison, is here. Thank you very much. He was, Your Excellency, I must say that he had a small challenge, and because of the AMREF Flying Doctors, because we have a set of aircraft that we use for charity evacuation, for transport, we were able to actually go to Mombasa and evacuate Mr. Morrison and bring him here. So we're glad we could offer that support to get him here in good time. The project we are discussing today, Excellency, is a launch of oxygen infrastructure. Of course, today we are going to launch visually about 20,600 oxygen cylinders. We have not filled them with oxygen because that depends on consumption. Yes, depends on consumption, but we have 150 here that are already filled with oxygen. These cylinders, Your Excellency, are marked Government of Kenya, Ministry of Health. Because, as Lyndon will say, the Global Fund is not a donor. It's actually a partner of government because it's a multilateral mechanism whose money is owned by governments, including the government of Kenya. And we are really grateful that they responded to the COVID-19 challenge of access to oxygen. We went through the government and Ministry of Health to the counties to assess the challenges of oxygen access, which were highlighted, as you said earlier, by the demand through COVID-19. And out of that, the mapping was done, and it was a dire situation. Many of the challenges we found, Your Excellency, were that oxygen was not available, that even where we had the production plants for oxygen, many of them were not properly maintained. But one of the critical challenges was oxygen cylinders. Oxygen cylinders became a problem because they were not available. At some point, we thought we had about 20,000, but they were disappearing in people's homes because of the demand and the need for people. We then found that actually, and the governors are here, and I'm really happy they're here, that for every hospital or governor to access oxygen, you have to put a deposit for an oxygen cylinder so that you can access that oxygen cylinder to be filled for oxygen for your patients. This, deposit was significant. In some areas, it was 4,000 shillings. In some areas, it was 17,000 shillings. And this project we are launching today, Excellency, removes the need and the demand for deposits from the governors to access oxygen. That is significant because now the oxygen can be accessed as and when needed. And that is why, with the support of the Global Fund for HIV, TB, malaria, we are launching today, and they are available in this country, 20,620 medical oxygen cylinders worth 1 billion shillings from the Global Fund. But these cylinders are just a visual representation of your honored launch of this project today, Your Excellency. This project is part of a 5 billion Kenya shilling project for $1 million through the support of the Global Fund special mechanism. The Global Fund supports HIV, TB, malaria, but we have been working with the Global Fund to ensure that the Global Fund also supports health system strengthening for countries not only to be dependent on the Global Fund, but also to build the health systems for primary health care and for universal health coverage. And during COVID-19, the Global Fund responded and said they are indeed going to repurpose some of the funds to support the oxygen infrastructure. So as part of these 5 billion, 1 billion is going to cylinders, but the rest of it is going to the construction of 22 oxygen production plants across the country, Your Excellency, supply and installation of 14 oxygen bulk tanks. These are bulk tanks that allow level 4, level 5 hospitals to have oxygen just right there, which is piped into the hospital, that they don't have to rely on cylinders. But beyond that, we've had a challenge. We found out that cylinders in this country and in many countries in Africa are used one cylinder, one patient, which means that whereas one cylinder can serve multiple patients, you have cylinders dedicated to a bed. This problem is being solved in this project, Your Excellency, by doing what we call manifolds to ensure multiple cylinders can be attached together and supply the oxygen to a hospital through a piping system, which means now that you can actually optimize the existing cylinders. That's also part of this project. This project is this manifold and tanks are going to reach 320 primary healthcare facilities. They are also going to get monitors for patients, but beyond that, these cylinders that we are launching today, Your Excellency, will reach more than thousands of facilities as the governors and the counties and the sub-county health teams deploy the oxygen. So I would like to proudly call this project, Your Excellency, with your permission, Hewa Mashinani. Hewa Mashinani. So this marks a major milestone, and this Hewa Mashinani project means no more cylinders. As I come to a conclusion, Your Excellency, I would like to say generally that AMREF Health Africa is a partner of government in delivery of primary health care and universal health coverage. One of the challenges I would like to bring to your attention and highlight, and of course you are aware, is that we will continue to work together with partners like Global Fund and others to reduce the burden of infectious diseases. But at the same time, we need to start paying attention to emerging non-communicable diseases, cancer, hypertension, diabetes, that are going to be a challenge to this, to our health system, and also diseases that are going to arise from the emerging climate change, on which you have shown excellent leadership across the continent. And we are happy that you'll be hosting the Africa Climate Action Summit in September in Kenya, and we commit to bring the health agenda to that summit that you're hosting, Your Excellency, ahead of the COP28, which has now formally agreed to have a health day to ensure that adaptation of the health systems to climate change is part of the climate change agenda. So, ladies and gentlemen, as I close, is to say thank you very much. Our universal health coverage journey is on plan with our partners. I don't know how many of us know here that for countries that claim to have achieved universal health coverage, largely in Europe, they spend $4,000 per person per year, all public money. In Kenya and in many countries in Africa, not many, actually all of them, we are lucky to achieve $50 per person per year of government money, combined between central and national government. So literally, Your Excellency, we are solving a $4,000 problem with $50, which means that for us in Kenya, efficiency, excellence, innovation is critical to achievement of universal health coverage, because we literally do not have money to throw at the health problem. Your Excellency, thank you very much. I wish to thank you, your government, the county government, the Global Fund. Thank you very much. Please, deliver our thanks to the Global Health Headquarters and to the CEO, Peter Sands. Our partners are, of course, the county government that we've worked very closely, and of course the team at the MOH that has worked with us, and the team at AMREF that's represented here by the country director from Kenya and Bernard Langat, who has been handling this project. Thank you for your attention. For God and the country. God bless Kenya. God bless you all. Thank you very much.
Thank you very much, Your Excellency. Thank you, Dr. Gitai, for that elaborate explanation.